Hey guys, what is up? Oh wow, it has been a really long time since I've gone live on here, and I apologize for that. I promise I'm going to be a little bit better about it. Um, but if you aren't already aware, I am in the process of writing a book. So it has been taking up a lot of my time, aside from just like seeing my clients and my patients and making sure everybody is well taken care of. So the book is just about finished. It got sent off for final formatting, and it is almost ready for you. So if you guys are interested at all in hearing more or ordering a copy of it, I'm going to put a link for the pre-sale here as well. So it is on pre-sale right now, and you get access with that to a free webinar that I'm going to be doing for people that join the pre-sale, where we get you get a Q&A with me, and a little bit of just a private workshop, and then you also get free shipping and all kinds of good things. So if you're interested in learning more, please go ahead and grab your pre-sale copy now. Honestly, your support means everything to me. And I wrote it for you. I wrote it to help you manage what you're dealing with and the reason that you're here. So let's dive in a little bit today about something that I want to talk about that's really been on my mind lately. I feel like this is a conversation that I've been having with a lot of my clients and people that aren't even clients but just are struggling with hip pain. And so let's chat about it. We're going to talk about how to manage your expectations around your hip pain, hip rehab, recovery, whatever it is that you're struggling with right now. I think, for me, my job as a physical therapist and as a coach to people is to help them manage their expectations around what is going to happen with their pain. And we all want pain to just be this beautiful linear line of better, 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 and it's gone. And the reality is that's not what's going to happen. It's very much going to be this like up and down journey. Some days it's going to be really good. Other days it's going to be really bad, and you're going to feel like you're at square one. It's going to be very much this like winding road. That's normal. That's to be expected. And I want you to almost anticipate it, because that way when it happens, you're like, okay, I don't need to spiral here. Jenna said this was going to happen. Here's what I do to fix that. And so it helps you develop a plan, but then not completely feel derailed if, a flare up does inevitably happen. I don't want you to feel like you're going to start spiraling. And so what I tell my clients to look for is the general trend moving in the right direction. So yes, it may be very up and down, but the trend of the up and down should be in an upward fashion. So maybe it flares up, but it doesn't flare up all the way back to it was before we started working together, or whatever that looks like for you. And so to expect that that's going to happen, but be knowing that you need to look for the general trend upward is really important, because you also don't want to find yourself stuck with a physical therapist where it's not getting better and it truly is staying stuck and plateaued. So it can be really hard to differentiate, am I stuck and plateaued here? Did this flare up send me back to square one? Or is this just part of the process? And again, a good physical therapist and a good coach, that's their job. That's my job, is to make sure that I'm helping my clients get through the weeds and figure out, like, is this good or is this bad? Am I supposed to feel this? Am I not supposed to feel this? So if you're not getting that from your physical therapist, I would encourage you to either ask for it or find somebody who's going to guide you a little bit better along that journey. So when we talk about what is expected in rehab and recovery, there really is no one expected path. Of course, everybody's going to be on their own journey. Everybody's going to heal on different timelines, but there's certainly things that we're looking for and would come to sort of expect. And so one of the things that I see with my clients is that when they first come in to see me initially, after the first 1 to 2 visits, and I start to teach them just a few helpful things, they get a really sharp decrease in pain. So maybe it's something as simple as doing some deep breathing. Maybe it is learning how to do a rock back exercise. Maybe it's a stretch, right? Like 1 or 2 things I teach them, and they're like, oh my gosh, this changed my life. I feel completely different. I understand what's happening now. My pain is better. Like, this is amazing. And that's awesome, right? Like, if we can get somebody to experience that change in just one session, like, what a cool thing. But here's the part that matters. That pain relief that you got is not long term. It is a temporary thing that you're going to feel. And if you don't understand that, when it inevitably returns back, you're probably going to start spiraling. There's a good chance that you are going to want to throw in the towel. And I know this because I've seen it with my clients. And I've learned over the years of doing this of how do I manage that expectation. So right up front, I try to tell people that. But if that conversation slips through the cracks, what ends up happening is people are like, oh my God, this is so great. I feel so good. And then 2-3 weeks in, they're like, this isn't working. I'm in so much pain. I am throwing in the towel. I'm done. This isn't working. No, that's not true. It's not that it's not working. It's that you haven't given it enough time to actually change your body. Your body hasn't been able to adapt and get used to the changes that you are making in it. And so without that piece, the pain is going to come back. We have to work through the process of initially we do need some quick fixes and some short-term relief. Because if you're in a ton of pain, you can't get to the later phases of layering in the movement repatterning and the strengthening and the long-term stuff that's going to make it all stick, because you just need to get out of pain. So initially, pain relief is what we are after. But if we stop at pain relief, you are missing the biggest piece of the puzzle that is going to prevent this problem from continually coming back. And so it is so important that you understand that that initial pain relief that you had is great, but it is not the finish line. It is one tiny little piece of the puzzle, and there's all this other stuff on the back end that we now have to work on. And I say this so that you know to not be frustrated if and when that pain does come back. Because we've talked about this before, but flare-ups are not the end of the road. They're actually a really normal part of the process, and you just have to have a plan of how to manage them so that you don't start spiraling and feeling like I'm going to throw in the towel. So it's just really important to understand that piece. Now, you know, when we look at those quick fixes, they can be helpful at any point throughout your rehab. In the beginning, they're great, obviously, to get you out of pain. Later on, if you have a flare-up, knowing what were those quick fix things that got me out of pain, right? But they aren't the thing that's going to make the adaptations happen in your body that's going to last long term. So for what you need moving forward is going to be really learning and understanding what are the movement patterns happening in my body and how do I correct them. And then we have to layer strength on top of all those movement patterns to sort of lock them in. That takes time. That is not something that's going to change over the course of 3, maybe 4 weeks. It's going to take longer than that. So what I generally tell people is, you know, I think that we can get you out of a significant amount of pain within the first 4 weeks, right? Like that's our goal. But I know that that's not enough to change your movement patterns, and it's not enough to get you stronger. So it's going to take closer to maybe 3 months of consistent, dedicated work and repetition before those movement patterns really take hold, and then you've strengthened them enough that you don't have to think about them every single time you do them, because you're going to have to do that in the beginning, and that's okay. Expect closer to 3 months for that. And within that 3-month time frame, there's going to be ups and downs. There's going to be flare-ups, but we're going to have a plan. You're going to know what to do. But you really do have to anticipate it's going to take a long time, especially if you're somebody that's had pain for a long time. Maybe you've had chronic pain. Well, that years of that pain building, even months of that pain building, it doesn't go away overnight. It's going to take a long period of time and consistency and repetition before these things take shape and really stick and take hold in your body. So we can't anticipate that, you know, it took my pain 6 months to build. Well, I'm not going to get rid of it in 6 weeks. I'm going to get rid of it in, again, a couple months time before I really feel like I'm back to normal. Now, of course, in that time frame, everything should be moving in the right direction, but it's not going to be 100% until some, you know, more time and consistency has passed. I think one of the other really common mistakes that I see people make is they get pain relief and then they tell me, I'm just going to try to do more of this on my own. It's been working, so I'm just going to keep doing what you gave me, and I'll check in a couple weeks. Makes sense, right? But I know that in my head, those patients, when they fall off the schedule or they want to just keep doing the same thing and stay status quo because it's been working, I know that those are the patients that are very likely I'm going to contact in a couple of weeks and they're going to tell me they're in pain again. And here's why. It's because you haven't progressed anything. Over that time, your body is changing. You can't stay with the same group of exercises just because they've worked in the past, because your body's going to be changing. Your pain is going to be changing. Your range of motion is going to be changing. Your strength is going to be changing. If you keep doing all the same things that got you to that point, but you never continue progressing, then you're going to stay stuck where you're at. You must keep progressing. You must keep layering in different challenges, different movements. For instance, maybe you feel really great squatting now. I can squat. I don't have pain anymore. I'm done, right? No. Because can you pick up your child when they're squirming around all over the place? Can you squat at the grocery store to pick up a 40, big, what is that, 40 count pack of water bottles? I just had to do that this weekend, so it's on my mind, right? Like, can I squat in a different environment that is less than ideal, right? When I'm exercising, everything's very well controlled. My weight is, maybe you're not even using weight yet and you're just doing it unweighted, right? Can you add load? Can you add challenge to that movement? And can you put it into real life scenarios? And that's just a squat. We haven't even talked about the other movements. And so if you stop and you stay where you're at and you keep doing the same things, yes, that's awesome. It's going to keep you where you're at. But it's also not awesome because it's going to keep you where you're at. And we know that there's so much more potential for you. And especially if you're still having a little bit of pain, we need to make sure that you keep changing and adapting and doing things that are going to work to get rid of the rest of that pain. If you just keep sitting on the same things you're doing, that's never going to happen. And so that is, I would say, one of the biggest misconceptions and mistakes that I see people make, whether it's with me or a different physical therapist or whatever. So just some things to kind of keep in mind. And again, to really try to manage your expectations around what you're experiencing, whether you're in rehab or you're just trying to get stronger, like wherever you're at within your journey. Just know that what you're feeling, those ups and downs, those flare-ups, they're normal, a normal part of the process. But the most important thing is having a plan forward. Because without that piece and not having a steady progression and an idea of where you're going to, you do kind of get stuck. So I hope that was helpful. As always, if you guys need anything, comment below, ask questions, talk to each other, whatever it is that you need. Use this space to connect with one another and to connect with me. So take care. I hope to see you guys again really soon.